Hey, how's it going? This is Tex. This is Tex Talks. I hope y'all are doing good today. Hope you're enjoying that spring weather as it comes in and that all the fun of the pollen and everything else has not started kicking in those allergies yet. But we do welcome the better weather. A little bit of cool, but a little bit of not so cool. So we're not freezing to death and the wind's not blowing us around everywhere. So today I wanted to talk about as I transition from my talks that I put out last week and some other previous ones where I was discussing why you don't necessarily get a diagnosis of BPD when you see some people, or NPD. So that's the borderline personality disorder, narcissistic personality disorder, or any of the other diagnoses that are personality disorder diagnoses. You don't see them as often because they don't get seen and recognized as what they are. The dependent personality disorder, schizoid, and, the schizotypal, all of these different ones, the avoidant, paranoid, there's a lot of them. Understanding the diagnosis is tough enough. Trying to train people in this, because most of the time, people don't really know nothing rather than what they hear in movies or TV or the internet, and they move into jobs as being in the mental health field as either therapists, social workers, medication providers, without a real basic background in that area. Part of the root of the problem is understanding a basis of where it comes from. There's a whole argument about that things are caused by childhood situations, trauma, and all that. And there's a partial truth to every one of those and how they're handled. But there's a part of it that is more what I would call myth than reality. The idea that data is showing that personality disorders is neuro and it's biological, it's basically inherited, it's genetic. Now, there is a little bit of a touch argument between, is it transgenerational, like some forms of trauma, that people will say that, well, these things are passed down and they're passed down because of what you went through, but they don't go through and explain that the genetic part of it, the genetic imprint that's in there, it's very convoluted. If you are born to someone who has a personality disorder, especially certain ones, then they are prone to having trauma in their life. In other words, the conditions around their diagnosis are such that they are going to feel things much more painfully than someone else, which can be traumatic. Their judgment may lapse, their impulsivity may be up, and all those things put them in situations because of what they're doing and not changing how they're doing things, puts them in situations where they experience trauma. Let's just say for whatever reason, it's inherited, and it's also up to you once you start figuring out you've got it to work with it. In other words, to learn how to handle it differently. It's no different than being genetically prone to alcoholism. If that's the case, then you know that you cannot go out and power drink with your buddies who don't have this and expect it not to affect you in a way such that you start to rely on it more and more as your coping skill, your crutch. Where does that leave us then when it comes to personality disorders? You can take what you want out of this. If you as an individual realize that you basically have very few or even one way of handling things, and that's the way you handle everything, stop and observe. See, we're back to that same thing of self-observation. And it's very difficult for someone who has personality disordered traits because often they do not have that observing ego, that look at yourself and what you're doing. So it takes a while for it to be realized that you're doing something that isn't working and you're doing the same thing over and over again. In other words, screaming and hollering is your way of dealing with stress. Running and hiding is your way of dealing with stress or trauma. Um, Pretending things didn't happen. There's all kinds of coping skills that people use. And in some situations, it's understandable. That's the coping skill that's got you through so that you survived the situation. And the problem is now that you're done with that, you need to learn more coping skills. Here again is where that lack of having ability to observe yourself comes in and lack of skills to choose from. It's a twofold part. It has two problems. And so I'm going to talk about it specifically with when like certain conditions like narcissistic personality disorder. Maybe someone who has this, or even someone who just has a few of the traits for this, handles things in such a way as that pushing their way through things and basically saying or believing that they are better than someone else, they deserve more, may actually at times result in them getting it. I mean, many times if somebody walks into a joint like they own the damn thing, people treat them differently. If they walk in there and they act deserving, many times people will be like, oh, that must be somebody important. Otherwise, they wouldn't walk that way. Now, did you just see the breakdown between reality and how one person sees reality and how another person sees reality? In other words, when you're working with anyone or you're even friends with anyone or know anyone who has these particular personality disorders or displays these traits, understanding them means getting outside of your way of thinking and being able to look into their mind, how they're thinking. Because again, we get that problem of people being stuck and going, everyone should know this. No, everyone doesn't. There is no such creature as common sense. We like to use that word, but it's only common sense in the number of people that have an agreement with what you feel is common sense. And that changes. And sometimes it even fails you. And what you think is common isn't good or right or even usable. So in this case, being able to pull yourself out of your way of thinking and going, well, if they're acting like they should be treated better, they obviously must be somebody important and should be. And for the person who's doing that, if it works a lot, why would they do something different? Where they get into trouble is when they run into a situation where people aren't buying it or people just aren't treating them better. And then they don't know how to handle it. Or they handle it very poorly and they go, oh, well, then I'll just act like I'm even more deserving. And then they will start to yell at people and call them names and berate them for not understanding their greatness. And if that don't work, then they'll just get downright mean about it or vindictive or find ways, give me the manager and I'm going to cause this problem. But they keep coming at it in the same way, instead of looking and going, oh, this isn't working. Let's change tactics. Many times people who do this will not be able to see themselves doing it. And then that's where it gets very complicated because other people may or may not be able to talk to them about how they're acting or behaving. And how we tell people and what we tell people and being able to observe from the other people's side of things makes it very difficult. Because if you look at that person and go, well, you're wrong, you should know you're wrong, and that's it, then they're going to get mad and go, how dare you tell me I'm wrong? You must be wrong. The argument's on and nothing gets solved. Many times we do not stop for a minute and go, what is the end that I want? Who is it I'm dealing with? And is it possible to get my end, still treat them like a person? And at the same time, if it's somebody that I have to be around a lot, how can I help them? Especially in the cases where they don't feel they need help. Many people with NPD, as I said before, won't come in because they see the situation the way you see the situation. They may see that, oh, I'm just having a problem and I'm going to lose my job or my relationship or whatever it is that's important to me. And only out of that fear of losing something important do they actually step in and go, I need to go see somebody. And then their thought pattern about fixing it may be very different than someone else who doesn't have NPD. Someone else may look at it and go, I need some help understanding what I'm doing wrong with my relationship. Someone with NPD may walk in and go, I need some help getting my partner to realize they're wrong. This, and how can I handle this? Or if it's really come down to it's like, hey, my partner's going to divorce me, leave me, whatever, and if I don't do something to stop this, they're going to be gone, and I don't want to lose them. So again, it's working that situation through. Again, referencing a previous video, a lot of people will be mad at somebody who behaves in a certain way, either, demanding, self-serving, feeling like they're better, acting like they're better than you, or in some other way, if you feel manipulated, if you feel controlled, you fight against that, and the other person is using what they normally would use to get through a situation. And here you are, and there's the problem. So a lot of it comes down to you being able to reflect and go, well, what is it that I want? What is it that I need? And do I want these people in my life? Because sometimes they're important people, they're family members. Um, please do not take this too rough. Sometimes you're just as messed up as they are. And I mean that in the best of all possible ways. Everybody has their own special set of problems. And maybe the set of problems you have are such that that's why this person was attracted to you. And I've said before, and I'll say it again, if you don't change and you just get rid of the situation will find you again, and you will be with the same kind of person over and over again. So figuring that out, or at the same time figuring out, well, how rough is it to put up with me? I mean, if you are someone who is dealing with a personality disorder yourself, and you're in a relationship with someone who has a personality disorder, that's what probably got y'all in the relationship together. So then you have to make those decisions like, do we both want to change enough that we can stay together? Is our marriage or our relationship that important? Or the other person doesn't want to change. I want things to be different. I'm willing to work on changing myself. They're not. So maybe we have to separate. And maybe then the other person panics and goes, oh my God, I didn't think he's really going to leave. So maybe they work on it. Maybe they come to therapy. Maybe they don't. It's very, very complicated. And for that, I apologize to all of y'all that life has put you in this situation because I don't think anyone picked to have this many problems in their life. I just don't. And I feel for you. And if nobody else in the world is going to say it, then I'm going to say it. It's a tough life to deal with when you have any of these personality disorders or any of these mental health conditions that are really messing up your life, making it stressful, making you depressed. So making you anxious, making it difficult to have friends or keep a job or live your life the way you want to. If you do want things to change, then you're going to have to take stock of who you are, what you're doing, who you're with, what are they doing, and what's going on, and what do you need to do to change it. Change is possible. Change can be done. Thing is, do you really want different results? I always repeat that same little line, the definition of insanity is doing the same thing over and over again and expecting different results. So, yes, some change will have to occur. Odds are that's going to be you having to make the change. If you find that everyone else needs to change, then that's something you should question. If you have a few people in your life and they're, creating a situation and maybe, them changing would be, beneficial, okay. But is that really the case? Or do you find yourself dealing with people, and all the people around you fall into these categories of problematic situations, people, things going on? Or are you finding yourself attracted to that? Highly possible. Again, you're going to have to work on your self-observations, which means you're going to have to be able to observe and think and reflect, which means you're probably going to have to do some mindfulness in one or another form, pick however you want to call it. You're going to have to be able to focus and see what's going on, hold yourself in a neutral place to actually observe without judging, and then go through and go, okay, I see this, this, and this. And then you can actually sit down and go, okay, what are the possible reasons for this? Ask advice, talk to people, get a therapist, good idea. And reflect on, okay, this situation is happening. What are the possibilities? And the kind of judging that should go on at that point in time, the kind of judging that you want to have happen is the kind that goes, if A, then B, not good or bad, not you're a horrible person or you're an awesome person. No. What what's gonna have to happen is you're gonna have to go, "Oh, if I yell, these are the possible reactions I get. In the past, I've yelled and everyone did my bidding. Now that's not working out. Or they did my bidding, but they were all scared of me. And is that really what I want out of all my relationships? Is a bunch of scared people doing what I tell them to do? Is it really fun? Is it real what I really, really want? Do I want to be an ogre?" Okay. And for some people, looking and reflecting on themselves is that's very painful to go, well, I didn't think I was that bad of a person. I thought I was a great person. And I've heard people say, oh no, I'm very kind. Okay, show me your kindness. And then they describe stories and I go, okay, obviously they have a sense of things that's different than my sense of things. They're seeing things differently. They're observing things differently. Takes a lot of delicate conversation to get them to go, okay, maybe that wasn't what really happened or what I really saw or what really went on. Okay. So I hope that's a start to making changes. And like I said, a transition from these personality disorders or these other mental health problems into being able to observe and realizing that there are things that you may be genetically prone towards that you can work with. You may not be prone towards, being very athletic. You can work on that, become more athletic, just like you may be genetically wired to be impulsive and you work on it. You don't blame the impulsivity for every problem in your life. You go, oh, I have a problem. I shouldn't do that. No different than, oh, I have diabetes. Shouldn't be gobbling up the sugar, people. Okay, all right, I know that. There are things that if I did them, my life would be better. You can't sit there and go, woe is me. This one condition, this one thing is the cause of all my problems, and I can't do anything about it. So I have, just no, 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 no. You can do lots. You can do lots of things, and it takes practice and time. Okay. So hope you have a good day. I'll talk to you later. Please, by all means, if you have any questions, follow-up questions, anything else, feel free to ask. Y'all have a great day. Take care.